People-powered health is making an enormous difference, finally, in health. Before now, we didn't see people involved very much because of all the intermediaries like doctors, hospitals, and I think now we're seeing some real advances. People have started to, for example, crowdsource looking at slides to see whether or not a tumor is cancerous. People have decided that they can crowdsource health in the way that we have transportation or music, and are looking at, if we put all our data together, can we understand something about our neighborhood, something about the health of a certain geographic area or a population? And we've seen some remarkable examples of that. We've seen people creating an artificial pancreas, putting together an insulin pump and the device that tells you whether or not your insulin is high or low. And instead of two different devices with you having to make decisions, putting those together in a simple little pack that lets your body know when do you need insulin and how are you going to give it. A kind of citizen science has finally arisen in health. Health and care would not be transformed without people being put back at the center. If you think about it, we're probably the only area in our lives that doesn't have a kind of consumer integration. If you're going to make a new car or a new cup or a new television program, you're going to ask people what they think, and you're going to put people at the center. And so I think for us to revolutionize healthcare the way it needs to be done, and health particularly, we have to understand that we're not going to be taken care of by somebody out there. Instead, we're going to be the ones who will take charge of our own health. People-powered health is going to have a lot of challenges. We have already. Some of us have been working 20, 30 years on trying to put people at the center. Health is extremely regulated, so there's lots of players. The European Medicines Agency, the Food and Drug Administration in the United States, on the drug level, if we get to the actual ordinary level of how we're going to integrate health into our lives, we have so many things we need to do. We don't think about health because it's a very long-term proposition. We like instant gratification. We like, if I make this change, my health's improved. And instead, we're going to have to be committed as people to a long-term. In addition to that, we're really fighting a lack of incentives and a misalignment of incentives in the system. So it makes sense for hospitals to do the things they do because they make more money. It makes sense for researchers to do the things they do because they can get more grants. And instead, we need to all focus on the North Star of what's best for people. To do that, we have to take what I think of as a cottage industry, an industry that isn't terribly sophisticated, isn't using technology, for example, the way other things are. It's not integrated technologies, and also a highly regulated industry. So both, simple but highly regulated, and that's going to be a real conundrum for us to move through. Next, I think we need to look at how much regulation do we need. So in other words, when institutional or human subjects review boards make decisions about what can we do research on, are we really making that in the interest of the person decision, or are we making that decision in the interest of an institution and perhaps liability? That would be one set of things I think we need to think about. The other set I think we need to think about is, and how do we propel people to be more active in their own health? I think we all don't get the connection. We think, I'm sick, I should go to the pharmacy and get the drug I want. Instead, we have to learn that we're really the center of this, and that the secret is we're the answer to this as well. So we have to unleash our own potential in moving forward to make a difference in this arena.